This is the book introduced today. I will go quickly. This is my agenda today. I will do a highlight of the book. How can you read the book? How you benefit from the book? Followed by some cases of cannot intubate, cannot scenario done using this new technique of ventilation. Quickly, why this book came? Already there is I try to change mindset, as Professor told us, to the new concept of ventilation, because still some people need brainwash to accept this new technique for ventilation. So I try to introduce most of this is new equipment inside the mindset of this is closed mind people. The first thing I have to tell you, this is very important message. I will read and you can read it, which is disclaimer. Our book aimed to summarize some published material and some clinical peer list. This first one. Second one, I am introduced the name of flow-controlled manual ventilation instead of Ventrain, but unfortunately I can use Ventrain at any time because it's the only mode in the market. And also Evon ventilator as flow-controlled ventilator in the market, plus tri-tube and ultra-thin or straw-sized tube. My book already contains 270 pages, 16 chapters, contains 6 black and white illustrations, some colored, more than 22 colored photos from experts. 10 embedded video teach you how to use the equipment, how to use the tube in a special situation. And it downloaded till today morning more than 1,600 download from the website. This is except Amazon payment, Amazon sales and Springer sales. This is I couldn't reach, but this is I can reach from the website. It is already a contribution of the expert from all over the world. Almost more than 40 authors contributed in this book from Netherlands, from Denmark, from Germany, from Middle East and the Gulf area. Already it is not technical book. It is already clear, practical, clinically focused. It is guide for you for clinical application, and it is fills the gap in the medicine regarding flow-controlled ventilation. It contains some clinical scenarios like obstructed airway, or like scenario can't intubate, can't extubate, or can't intubate, can't ventilate. So all these scenarios can be included or can be reached inside the book. It is evidence-based and already come from frontline experts using this mode of ventilation and writing their chapters. Who the target reader of this book? Maybe technician, maybe nurse anesthetist, maybe some specialty like maxillofacial like ENT, anesthesiologist as well, pulmonary surgeon, chest surgeon, ENT surgeon. This is our target reader of our book. It is already daily practice support you, evidence-based. It is already change, explain the change of the paradigm change of the ventilation from big tube to small tube to no tube in the airway during upper airway surgery. It is designed to be daily reference. It is not textbook keep in the shelf. You can keep in the bucket. Even you can revise every chapter alone. It stands alone. For example, if you try to read something about use the tube in the tracheal surgery or ENT, no need to go to read the physiology or need the tri-tube. It is on one chapter for you. One chapter is almost booklet for in your bucket during the revision of this case. It is already blend the theory and the practice, so rich in visual imaging, videos, some colored images inside. The book overview will 16 chapters. The first couple of chapters working about traditional and non-traditional ventilation techniques. The coming chapter will speak about manual and controlled ventilator device, which explain Ventrain and Evon. The following chapter cover the using flow-controlled ventilation in laparoscopic and robotic abdominal surgery, in ENT, tracheal surgeries, pediatric uses. Also, it is inside, you can find the past, the present, and the future of the mode of ventilation. And I would like to close these sentences, which is very important for me. We conclude our work by emphasizing that knowledge sharing stands one of the humanity best or greatest act in his life. So please try to share your knowledge as much as you can. And another very wisdom, which is very important, give man fish, you feed him a day, but teach him fish, you feed him for life. Inside the book, you can find some picture of some tricks, how to use Ventrain, how to dump the noises of the machine. Here, the history and evolution of TriTube from the starting, from the epidural catheters till now, the current edition. Also, some tricks how to use a TriTube in special cases, how to lubricate the tube, how to insert the tube in the better way. Also, some measurements can help you during insertion to prevent the migration of the tube from one lung from during insertion without any effort from your side. Also, how to use tube in tube technique or tube in LMA technique. How to use in the some cases of like COVID or like infection to prevent infection of the surgical or healthcare team. This is some cases already done in our center. During COVID, we have many cases of tracheal stenosis post-COVID. Most of these cases done in our center using TriTube. And you can find here the difficulties. How can you intubate, for example, cases like grade 3 or grade 4 tracheal stenosis without using of TriTube is impossible. Another group of cases already done in our center using this is flow controlled ventilation and the TriTube. Also, you can find some tricks inside how to use LMA as a conduit of the tube, how to use the nasal intubation. Special case I will be discussed during this case discussion with its last picture. And also here, how can you use guide wire for nasal intubation using this is TriTube, and how to use it in tracheal surgery. If you find the tube in the trachea and the surgeon can work freely without any interruption by big tube. Also, some tricks how to use the tube in the one lung anesthesia, how modification can help you for one lung ventilation using these techniques, and how to use it in the kids or neonate using this is high flow controlled ventilation. This is example of the videos embedded inside. You can find here, you have one scenario, patient couldn't ventilate by mask, but he ventilated by LMA, and you would like to change the LMA with TriTube. This is a very nice trick. Just put LMA inside, push TriTube till stop, and go parallel with fiber optic inside, intubate under vision, then remove fiber optic, then remove LMA, and keep TriTube in place. This is very nice trick, can help you instead of entry catheters, you can use TriTube for this is trick for intubation. Okay, another trick you can use for nasal intubation. In some cases, you have scenario where you need the mouse is free from tubes. You can how to use the nasal. Just put nasopharyngeal airway and put the tube through nasopharyngeal airway and use McGill to redirect the tube for intubation. This is some tricks, and other many videos can help you special tricks for using the TriTube in the management of airway. Some tricks also to help you how can use Ventrain for short surgery. I used many times for tonsillectomy or something using TriTube. And also how to use the Ventrain to oxygenate the patient using fiber optic, using, for example, you have AMBO, you can oxygenate using TriTube. And at same setting, if you have secretion in the patient, you can do suction by just manipulate your finger. As you see here, if you found the blue dye, you can make suction and the suction of the airway without removal of the fiber optic from place. Yes, most of our people, especially the old group, resist for training or teaching, or all of us looks like afraid to move the first and need someone move in front of you. Just watch this video and tell your comment.